State Representative Janine Nodder, and this is Chatting with Janine. And this could be the worst tick season ever. So my guest this week is Dr. Julia Greenspan. She's a licensed naturopathic doctor and a Lyme disease specialist. Welcome to the show.
Thank you. Thank you.
I hope your mic's on.
I think it is.
Okay,
yep.
It's on. So, I don't like ticks. No one does.
Yes, they're kind of gross. I actually have never seen a tick until I moved here. I grew up in Portland, Oregon, and Lyme disease is not the same there. It's just kind of, coming out of med school, you learn what the standard clinical presentation is, but it's really not what's happening. And I've never lived in a place where I was under attack by insects. Yeah. And I'd never seen a tick before until starting to pull them off of my pets here in Merrimack. And then people started showing up at my clinic. I opened it up about 5 years ago. Right. It's in Amherst now. And people just started showing up that had tick-borne disease or symptoms that were very mysterious and didn't really fall into any category. And when I tested them for Lyme, that's what they showed up positive for. And once I started treating them for that, they got better. So now my practice is about 100% Lyme disease, all ages. My youngest patient is about 18 months old, and my oldest is in their 80s.
Wow.
Yeah.
So let's back up a little bit.
Sure.
Your practice is called Greenhouse Naturopathic Medicine, and it's been a while since I've done a show on health and fitness, so let's tell the viewers, what is a naturopathic?
Well, a naturopathic doctor, it's in a sense, it's a primary care doc. I'm basically trained to deal with anything that comes in the door. We do the exact same procedures to diagnose, lab work, diagnostics in order to come up with a diagnosis, but the way that we treat is differently. So being a naturopathic doctor, it's a 4-year postgraduate medical program. We sat for boards. I'm actually the chair of our board for the state of New Hampshire.
And a Merrimack girl, too.
Yes.
Right.
So we're governed by a body that makes sure that the doctors that are practicing here are properly educated and pass their boards and are still continue to be suited to practice. But basically coming to see a naturopathic doctor is basically the difference is that we have time to listen. So an appointment with a doctor, a naturopathic doctor, usually takes about a half an hour to an hour, whereas in most unfortunately, in most conventional medical appointments, it's 10 minutes. And so we take the time to listen. We really want to identify the cause. And once we do that, I can use conventional methods to treat, medications, pharmaceuticals, things like that. But actually, I prefer to use herbs, botanicals, homeopathic medicine, lifestyle management, nutrition, whenever possible, in order to help the body heal.
And you're a Lyme disease specialist. That you have a lot of patients that have Lyme disease? And
yes, and I'm also a patient myself. So I
wow.
developed it. I found out I had it in the fall. I don't remember ever being bit by a tick. Most of my patients don't. Most of my patients don't get the bullseye rash. Or they get a little bit of redness around a bite, and sometimes it's called a spider bite, or in most cases it is. But I found out I had it. I just had all these random symptoms, and I explained them all away. I'm a new mom. I have a 4-year-old and a 2-year-old. I'm running a business. Oh, that's why I'm so tired. I don't get to the gym as much as I'd like to. Oh, that's why this hurts and that hurts today. I'm exhausted. Collapsing on the weekends. Oh, it's just because I'm doing too much. And I finally got to the point where
it can be anybody.
It could be anybody. But in this area, with this, we are in the most infected part of the country as far as Lyme disease. So southern New Hampshire and northern Mass now trump Connecticut and all the places you would think, like Lyme, Connecticut, and that we kind of think of in terms of like, oh, it's over there. No, it's here now. And so it's a really big problem. So I think everybody, honestly, from where I sit, I think that every new bite should be treated with antibiotics. And we're going to talk a little bit about, testing a tick and how to remove. And also that people should be tested regularly on a yearly basis, just like getting your regular blood work done. You want to know what your cholesterol is. You want to know what your vitamin D is, what your lipids are. Well, you also live in an area where a majority of the ticks are infected. So why not? And if you don't know if you've had a bite, they could bite you in the middle of the night. If you have pets that bring the ticks into the bedroom or on the couch.
So it's important to check your children and your animals every time they come in from outside.
Absolutely.
Where do ticks like certain part of the body
Yes.
more than the other? They like the head? Tell us about that.
They don't like anywhere the sun shines. My patients laugh when I say that. Okay. But they will. You're out in the woods. They will crawl up on your leg, up into the pant leg. They want to go somewhere that's dark, and also they're going to go to places that you're not going to be looking at. They're not going to bite you, or attach. It takes a little bit for them to attach. They're not going to attach here, on the arms or on the legs where you can see them, which would make it really easy to kind of just notice that they're even there and take them off before they even have a chance to attach. It's going to be up in places like along the hairline. A lot of times is where, especially children, where people will get it because they're not paying attention, or just, they don't notice it until they wash their hair the next day, that something's attached there, doesn't feel right. A lot of times people get bites in the groin or even in the belly button. A friend of mine had a bite in the belly button and she was horrified by it. But again,
keep your belly buttons covered.
I know. But yeah, so they're sneaky, and they vary in size, and so you might not even ever see them. Nymphs are, I've had arguments with my husband, like it looks like a little grain of a speck of dirt, and we pass it back and forth. You almost have to get a magnifying glass out to be able to figure out
no,
if
there's
it is or
different
not.
kind of ticks too. My neighbor came over one day. She had felt something on her neck and said, "Is this a tick? What is it?" I'm like, and I'm freaking out because I'm from the West Coast too, so I didn't know it. I don't know what to do with a tick. So I called another neighbor, and he came over, and he lit a match. So I hope I didn't get in trouble. He lit a match, which I don't smoke, so he blew it out immediately and then touched the tick. And it went like this, and then it died. And then he took tweezers, and he pulled the tick off.
Okay, so I'll tell you why that's not a good idea. You don't want to tick off the tick while it's attached to you, because how we get infected is that basically the tick, it attaches, so it goes in, and it'll express chemicals that deaden the sensations on the skin. It doesn't really serve them well. Like with a mosquito, we feel a mosquito when it bites us, and so we instantly, you feel it. Even if you feel it somewhere that you're not looking at, you're like, off, I want you out. Well, it's not a tick needs to attach for a longer period of time to eat. So it serves them well. It's a survival mechanism that we don't feel it when they're feeding off, or when they initially make an attachment, so that they can get time to eat. So they attach, they take in, again, I'm going to get kind of graphic here, but they take in what is referred to as a blood meal, and they take in some blood, and then they regurge back into your bloodstream, and everything that they've bit before that, they've picked up bacteria from.
And they put it in you.
And they put it in you. And so a friend of mine, another practitioner, referred to this is nature's dirty needle. So basically they walk around and they will pick up meals from deer, mice, birds, squirrels, cats. And there's diseases that are unique to those different rodents and different animals that they pick up along the way. So basically, getting back to the match, or Vaseline that you're holding in your hand, or kerosene, or garlic, or even just playing with it. So think of it in terms of, like, let's say that the tick is attached. It's got a little bit of blood in it, but it hasn't yet regurged. Maybe you got lucky and you didn't get the contents of the bacteria in the stomach into your system. If you start to mess with it, stress it out, burn it, agitate it, or if you go in to try to pull it, but then you get a little skittish, like especially if it's a child and the child is screaming, you're worried you're going to hurt your child, so you kind of pull and you're like, I'm sorry, and then you eventually get it out. What you want to do is you want to take tweezers. I like the curved head tweezers.
Right, these are very good tweezers.
Whatever you got that'll work. But you want to get right at the base of the neck, right as close to the skin as possible. So you want to come in right, and let's pretend I have a tick attached, but right in as close as you can to the skin, and then pull out as fast as you possibly can, because any stress that you put on that tick, or any sense that it feels threatened, it will get agitated, and then it'll regurge back into, regurge some of that blood back into your system, which does you no favors. It increases your chances of being infected.
So what happens if you don't do a good job and you go to pull the tick off and everything comes off except the head?
Well, what's carrying the diseases is the stomach, although there is reports that there are bacteria in the mouth parts of the tick, but that's already been done. If it's already in there, it is what it is. The head, you can go. A lot of people come into my office to have me remove the head. A lot of times, though, the head the body will reject it and push it out eventually, as long as you cover it with some like antibiotic ointment. Make sure you don't get any infection.
This is what when I first moved here, learning about ticks. Some people told me put Vaseline on it, but what does that do? Is it like supposed to suffocate them?
Vaseline on the tick before you detach it?
I don't know. I've never dealt with ticks before.
I don't know. It really, Vaseline or applying anything to the tick at all. I think that it's just about removing it, and then if the head is still left over, making sure that you put some Neosporin or antibacterial ointment on it, and that you're watching it. And eventually, most of the time, the body will push it out, and it'll just kind of fall off, even almost like a scab.
And where do you buy these? Do they have these like at
You know,
the
I can't
pharmacy?
remember. I can't remember. I can't remember the. I got that off of a veterinary website. Vets really are where it's at with understanding tick-borne disease, because they're seeing it in animals all the time, treating very aggressively with antibiotics and removing them all the time. And so they really, veterinary clinics and things like that will have the necessary tools. There's also a company I like, and they're called Mainly Ticks, and they have a kit that you can get and take it out with you, and it helps you. It has a card in there. I love these guys. You can make one for yourself, but they kind of put it together, and it's tweezers that has a magnifying glass attached to it, as well as an identification card, so you can kind of see, okay, what kind of tick do I have here? And then it also, the next kind of part to this is sending it out to be tested, and they actually have the little canister with a cotton ball where you can actually put the tick in and send it out. And there are companies that will test the tick for diseases, which is actually more specific and a lot easier to glean information from in most cases than from our own blood.
And ticks come in different sizes. Like the bigger ones, those are easy to see, easy to take
Yes.
off. My neighbor's son had a deer tick, and she showed it to me. It was so tiny.
Well, this is a deer tick, and
Okay,
you can
I don't-
tell, if
I
you
don't
can
know how
see,
much you
if
can zoom
anything that
in.
you can pick up from that picture is that the red body, the red crescent shape at the base of the body,
Oh, yeah,
that's
I
a
see
deer
that
tick.
red.
That's very unique to a
Ew.
deer tick, and that's actually a female. Males tend to be more brown, but that is an adult tick. That's the size of an adult deer tick
And look
right
at
there.
how tiny it is. See,
And it has probably a little bit of blood in it as well, which
There's my
enhances the
pen.
red. But even a tick, it's sort of like a brown crescent or a redder shaded crescent. So let's say,
That would be very hard to see on your
Yes.
kid, especially if your child has dark hair.
yes, the
So
hair
there it is
the
against
worst.
a cotton ball.
There you go. So basically, you remove the tick. You want to put it into a baggie that has a moistened cotton ball just with water. You don't want to do alcohol. A lot of places will tell you put it in alcohol. But if you want to send it out to be tested, what's the most antimicrobial antiseptic agent that we use all the time? Alcohol. So it's going to denature and kill the bacteria that's in the tick. So if you just store it, it'll be just fine, and it'll stay alive. Those little things are hardy, and if they have
this
moisture,
thing alive that
no,
I'm-
actually,
Its legs fell off.
its legs
Ew.
fell off. It's a little dried up. They dry up really fast, and so this is a unique feature about ticks, that they love the moist weather, moisture, darker areas. So ideally they're going to be in the forest or like right at the edge of a
stay
yard.
out of the woods this year.
Stay
Well, man,
protect
that's-
yourself and
It's like
stay
telling
vigilant.
a puppy not to wag its tail.
Yeah, I mean, I don't ever want to encourage people to be afraid of nature. But it is just about taking it more seriously. I think that what I've noticed, being someone who's not a New Hampshire native or a Northeast native, is that people who've grown up here around ticks all of the time, their whole lives, they just are like, a tick's a tick. What are you talking about? I pulled these things off of me ever since I was a little kid. It's not a big deal. It's not taken as seriously, but there's been a real big shift in the amount of infection and in the amount of population of ticks since most of my patients were children. And so things have changed, and so I'm just trying to get people to change with that and become more vigilant, that they need to be more concerned than they might have been when they were younger, where
Is
it was no
anyone
big
else
deal.
getting itchy? Listening to this show? I'm not going to get itchy. I wanted to go back to the Lyme disease. Tell
Yes.
me the symptoms besides being tired, because being tired, I mean, that's anything. That's
Yeah.
just life makes you tired.
Yep.
Children, thyroid disease.
Yep.
A lot of people have that too.
And there is a lot of overlap. It's now called the great imitator. Syphilis used to be called that. And actually, this is a bacterium that is similar to syphilis.
Ew.
Yeah. But it's now the new great imitator. So it looks like a lot of different things. But I would say the cardinal symptoms typically are going to be headaches, ringing in the ears, frequent sore throats, joint pain, obviously joint swelling. It doesn't always have to be swollen joints, but a lot of times there are. Migrating joint pain. So, if it's always been your knee that hurts, you get up in the morning and it's like your knee hurts and it's always there, and you have an injury or something that's predisposed, it's probably arthritis. If it just stays right there and you don't have anything else going on.
Swelling,
but
odd swellings, like your leg is swelling one day.
Yeah, some people can have a whole limb swell. And a lot of times that has to do more with different co-infections. So we're not just dealing with Lyme, we're also dealing with other diseases that this
Right.
tick is giving us. And that can be different for everybody. So, or different for each tick. Some ticks can be loaded with all sorts of them, and some are just going to have Lyme. And each one of those diseases has its own personality and how it presents in the patient. There is a lot of overlap, but there are some distinct characteristics. But with Lyme, Bell's palsy is another one that's a real strong sign, and that's a lot of, most docs, if they were to see that, and especially know that there was an insect bite or a tick bite, they would be on that and be treating it right away. But a lot of it is fever, like a new bite. If we want to talk a brand new acute bite, it's going to be feeling like you have the flu, fever, body aches and pain. Again, back to the headaches, numbness and tingling in different areas, night sweats, changes in vision, heart palpitations, chest pain.
Gosh, there's
It's
so
really-
many.
and
of
that's
it.
the worst of the worst. There are some people I have that just have one or two symptoms and they have Lyme. Children are the hardest. I treat a lot of kids, and kids, it's usually knees, stomach, and head. Their knees hurt every once in a while. They get belly aches. And we're talking kids that are maybe 6 and under. They're learning about what their bodies are doing or what things are like, but they can't. Especially when you get like 4 and under, have a really hard time explaining how they feel and knowing that this is something different. Like this shouldn't be like this. They haven't been on the planet long enough to know the difference. But, a lot of times if kids are complaining about headaches, kids younger, especially young kids like that, shouldn't be having headaches every other day or multiple times throughout the week. And a lot of times it'll get diagnosed as other things when Lyme really hasn't been investigated fully, especially living in this area. So, and kids are the most at risk. So they're out playing in the woods more than we are, and they should be. They should just be allowed to be kids and go out and have fun and not worry about this. They may get a tick on them, pull it off, and not think anything about it, not get, just a bug, and, depending on the temperament of the child, and not even tell mom and dad that happened. And as I said, very few people get a rash. Very few people get any alarming symptoms right off the bat. I never did. And it just is something that kind of, gradually over time became worse and more pronounced. And that's a lot of times how it will go for a lot of people. And that's really the scary ones. It's a gift when you find the tick on you. It's a gift when you get the EM rash, because then you know where point A starts, and you know that you can treat it right away, and then you reduce the chances of becoming one of the, kind of the scarier or the scarier chronic cases that a lot of people, when they find out they have Lyme or they look up Lyme, they go online and they get themselves all scared and
Right.
looking at all the stories out there. And there are patients out there that are struggling terribly. Those stories do exist. But if, my reasoning and wanting to come and talk to anybody who will listen is that if they're lucky enough to find the tick, lucky enough to get a rash, or to get some sign that something's going on, treat it right away. Or even if you just find the tick, treat it right away. Pretend that thing is the most diseased insect that's ever walked the planet. The person will recover from being on antibiotics, but they may not recover from having long-term Lyme.
So you don't use the match, don't use
Nope.
Vaseline.
Nope.
So call the vet and see if you can buy these from the vet.
Yeah, or online. So if you just go online and search for curve nose or tweezers. Also, again, I mainly ticks. If they can look up that website, they've got the little packages, and you can even buy, I think, the parts separately that have the tweezers. They're the first people that come to mind. But again, if they just go online and look for tweezers for tick removal, and if they can put together a little kit for themselves to take out, put in the backpack if you're going to go out with the kids or the family, and have stuff ready just in case.
That red, that's the body part, and the black part is the head
Yes.
of the tick. So just to go over this again, you use these, and somebody's cell phone's ringing, that's all right. You go down as close to the head as you can get. You pull it out as fast as you can.
Exactly.
Put it in a plastic baggie with a cotton ball that's wet, not with alcohol or anything, just water.
Yes.
And then get it to a doctor.
Well,
lab.
and that's the thing. A lot of people, like I had a patient who brought this. This was found on a patient's friend's dog. And I've
How
in the
did they
past week or
find that
two,
on a dog?
in the past week or two, I've been having people come in saying that they're now starting to see them on their animals, and this is unusual for this time of year. This is going to be a really, really difficult tick year. It's been mild since last spring. It's been the perfect conditions for ticks to thrive. And, we didn't have a lot of snow this year. We didn't have a lot of low temperatures. Ticks are still active in the upper 20s. And then they need to, and then having snowpack on top of them, a lot of the larvae that are born will die off, or the animals that they typically feed off of to thrive will die off because of the conditions, and that's not the case this year. So, what's going to happen is that those ticks are going to, the animals that normally carry them are going to be more in numbers, and they're going to come closer into our homes. There's going to be more ticks out there. And then also we have an issue that the trees decided last fall that especially the oak trees, that they weren't going to drop as many acorns. Whereas the year before, in Merrimack, I was
Bumper
pulling
crop of acorns.
Oh my gosh,
yeah.
I was pulling oak trees out of my lawn like crazy, and those roots are strong. And this year there was hardly any. And trees do this every once in a while, but that's a big issue with the animals that normally would feed off of those too, and that they're going to be looking to us to feed them and coming closer into where we live.
Oh, so less acorns means less squirrels in the yard, which means less ticks going after the squirrels, and means they're coming in to get you and your kids and
It means
your dogs.
more squirrels in our yards looking for our food to feed them.
Oh, they're going to eat my bulb plants again.
So, it's just and all of that, and then an early tick season. So yeah, we're starting to see this on the pets, but pets means that, that eventually, if not already, they're going to be on people and earlier. Normally we don't start seeing this until April or May. And here we are at the beginning of March having practically a 70-degree day today.
Oh, it was 73 actually.
Oh, Lord.
On the day
I
of
was
this
inside
taping.
all day.
I'm going to be replaying this show throughout the season. This is a good one, especially with all the ticks. Is there anything we can do to prevent having them land on us in the first place?
Well, being a naturopath and an environmentalist from Oregon, I am, I wrestle with
And your name
what
is
to tell people.
Greenspan. What a
Yes.
perfect job for you.
I wrestle with trying to tell people what to do about this issue, but honestly, the only common sense response is DEET or the chemicals, because if I have to compare, if it's just a matter of bugs being a nuisance, then please use the geranium, use the pennyroyal, use what's the stuff that you burn in your front yard that starts with a C? I can't even think of it. The real smelly.
Oh, I know what you mean.
Citronella. Yes, thank you. The citrus, all of those things that are have very strong odors detract insects. Oh,
They're
that's how
supposed
they
to.
find us. Ticks they can't see, they can't hear. They smell us, and they smell our carbon dioxide. They feel our heat, and they smell us from amazing distances. I mean, you think a dog has amazing smell. They get trumped by these insects. All insects, that's how they find us. They are attracted to our odor. So a lot of the repellents, deal with creating a strong odor to make them want to go away. But honestly, when it comes right down to it, DEET is also a nervine, so it kills them. Again, if I have to choose between having Lyme disease and seeing how it devastates families, to putting a little bit of insect repellent on a few times during the year,
Make
when
sure
you know
you
you're
wash
going
it
to be
off, because you don't want to go to bed with that DEET in your
No,
skin.
you don't. You want to wash it off, and also using it on clothing. So I'm a big proponent of, spray it. Have your
clothes
kids
and
wear
your
socks
hair.
and shoes. Spray it on the socks, spray it on the shoes, on the shorts. Put it on a hat, and then put that on your head. And for girls, putting the hair up in a pony and pulling it up in order to protect their heads from having the ticks go up into the back of the scalp without being noticed. So that, obviously using it responsibly, and yes, washing, taking a shower, and even if you don't wear DEET, taking a shower at the end of the day, if you know that you've been somewhere that's got a lot of ticks and you've had a high exposure, is a really good idea.
Wow.
But also treating the yard. So I treat my yard. There's stuff you can buy at Home Depot. There are companies that come and will spray for ticks. And I do think that's a good idea. Again, so our children can go out and play and have us not worry about what's happening with them. At least try to the best of our abilities to have that happen.
Now, you did say that the ticks don't like to go where the sun shines. So if you're in the sun, you don't have to worry as much about the ticks getting on you.
Most cases, yes. And also they don't like short grass. So keeping your yard, keeping the grass cut short, not letting it get too long and too, meadowy.
Right.
Because
Ours
that's
is
where they're
long,
going to be.
Long grass needs less water, so
Yeah. I know.
fix one thing, cause another problem.
But also if you remember last spring and last summer, there was a lot of cloud cover. It was actually very gray, a gray spring and summer. And so there were ticks out in the open field. They'll get more aggressive if there isn't frank sunlight shining down on them, and also moisture. So if we have an extremely dry year, like the summer before, if most people remember, but the summer before last was a very dry summer. We didn't get a lot of rain, so there was very few ticks. And I noticed the difference in that fall compared to this last fall in my office with the amount that were coming in. So there's certain patterns with weather. Weather plays a really big role here.
I like to rake my woods every year, but I'm either going to skip this year or make sure I spray the woods first. I don't want to get ticks
I
on
can't stand leaf blowers, but in this case, that might be a good idea to just get a leaf blower and stand back and let it go.
Yeah, well,
I don't like the noise pollution or the pollution in
I just
general.
don't like having all that dry brush, and it's fine.
Yeah.
So I like the ground clear, so I usually rake up, and then there's ferns and there's little plants that grow in the trees. But, I'm scared about these ticks now. And
Well-
we have a minute left.
Oh, gosh, that went by fast.
It does go by very fast. But, Dr. Greenspan, thank you so much. And tell me again where your practice is.
Yeah, my practice is in Amherst, New Hampshire, just right off the 122. It used to be in Hollis, but we just moved a couple weeks ago. We're very excited about our new space. It was much needed. We were outgrowing the other one.
I go to the chiropractor right around the corner,
Yeah.
Spinal Corrective Center. Oh.
Great.
But thank you so much for making me itchy and telling me all about those bugs.
You're welcome.
And I wish you all a tick-free season. Good luck. Thanks for watching.